Hi guys, Alan Eldridge with Optimal Movement Physical Therapy in Redlands, California. I'm here with Sean Lee. We're going to be going over the slump test. Slump test is a really important test to help with identification of any nerve issues that a client might have. So it's really great for individuals who've had a diagnosis of sciatica. But it can also be very beneficial if you're suspecting a nerve issue for individuals with other diagnoses such as plantar fasciitis or Shin splints, or even in Sean's case, hamstring strain. Sean has a history of chronic and recurrent hamstring strains with running, so we're going to go over the slump test and see if we can't replicate his symptoms. I'm going to have you sit down on the table. I'm going to have you scoot all the way back so that your legs are touching the edge of the table, hands behind your back, good, knees together. And the reason for these 3 steps is all about consistency. You just want to keep the test consistent, so do it the same way every time. During this test, let me know if you get any symptoms, whether it's burning, pulling, or your hamstring strain symptoms, whatever it might be. So I'm going to have you go chin to chest first, and then I'm going to have the individual slump. So I cue from here and I help push down. Okay. Any symptoms at this time, Sean?
No.
Go ahead and straighten out this knee. Any symptoms?
Yes, the hamstring strain.
Okay. Where?
Right over here, my hamstring.
Okay. So what I'll have you do is just elevate your head. And does that change what you feel at your hamstring?
Yes, it goes away.
Goes away. Okay, so back down and then up through here. So simply performing the slump test and replicating the symptoms is not enough to really implicate the nerve. But if you can replicate the symptoms and then change the symptoms by moving a body part far away, and if that changes what he's feeling, that really does help implicate a nerve, and it helps guide what the treatment may be. The reason for this is your hamstring muscle does not attach all the way up to your cervical spine, so moving the cervical spine actually does move the nerve. If that changes the symptoms, it helps implicate that the nerve may be the issue as opposed to the soft tissue. Treatment for this is what we call nerve glides, and so we can do it a variety of ways. A great way to do it is via the test that we just did. We'll have Sean go into the exact same position, slumping through here, sitting really lazy, and you're going to elevate your foot just until you feel the symptom. Once you feel it, you're going to lower your knee, you're going to sit up nice and tall, and you're going to make sure that that symptom goes away. And then you're going to drop back down, slump, elevate here, do them at the same time, recreate that hamstring strain, and then up, good, make sure it goes away, and then again, good, all at once, perfect, and up. Great. So dosage for this really depends on your patient's symptoms. Somebody who's very irritable, has a lot of acute pain, this exercise may actually reproduce their symptoms. In that case, you'll have them start with a very low number and see if they can build it up with tolerance. For somebody that is having just a hamstring strain, it's more of a nuisance preventing him from doing his athletic activities, we're going to just start at a base number. We'll start at doing 10 reps of this, and he'll do it multiple times a day. I'll mention up to 5 times a day, and then he'll come back in about a week, and we'll see how he's doing, if he's ready to increase it or not.